Kenya, of course, has a challenge with the maternal, newborn, and child health. As you know, that demographic survey that was done recently revealed that we have serious challenges on maternal health. In fact, for the last 15 years, maternal health has never improved. The figures have not changed. The newborn rate is also a problem, and that's why the EU is putting a lot of effort to make sure that we put more money in maternal and child health to see whether we can accelerate the achievement of the MDG 4 and 5 in this country. AMREF Italia won a contract with us and grant with us of about 580,000 euros to support maternal, newborn, and child health in Makueni and Kitui, and is basically working with the communities, training communities to understand what maternal and child health is, trying to assist mothers to understand what they are supposed to do on these issues of maternal and child health, working with community health workers, training traditional birth attendants, helping community health extension workers, which are basically nurses in dispensaries, and supporting dispensaries to be able to give services that are related to maternal and child health and reproductive health, including nutrition. The way the AMREF Italy has done their work, they have established 2 community units in Kitui and 1 community unit in Makueni. And from the way a community unit is formed, the community health workers are trained on how to collect information and they put it in a chalkboard. So you could see the improvement of health indicators related to maternal, newborn, child health. And from the way I saw in both occasions, because I was involved in reading, going through the data, there is tremendous improvement of indicators in maternal and child health. And I believe personally, if such interventions had been done a long time ago, we would not be having challenges in achieving MDGs. AMREF Italy was able to integrate this new project of maternal and child health with WASH. And you know, the water committees which had been formed there before became more active on delivering messages on reproductive health, on issues of maternal and child health. And I could see from the discussions and the skits and whatever the women and the communities that I met were discussing, you could see there is a lot of impact in that kind of integration. And also they are putting income generating activities in their program, in their systems. So these income generating activities, together with all this, the integration is making things work very well. And the communities are motivated to spread the word, to disseminate this information, to educate others. And you could see a lot of improvement in these simple interventions with the minimal costs. What they are doing so far is okay, but with the minimal funding. If more funding can be availed to projects or to NGOs and government to support establishment of community units. Community units actually do a lot of things other than just maternal and child health. They actually affect the entire health condition of the area and environmental issues. So if these community units can be strengthened, and then referral systems can be strengthened, because most of these areas that are visited, other than Makueni and Kitui, if you go to Kajiado, you go to Narok, you go to Turkana, where we are working, you go anywhere in this country, you will discover the biggest challenge is the distances between the health centers, the health facilities, and where the communities live. So when the mothers are pregnant and they are supposed to deliver, referring them to the hospitals or to health facilities where they can get services is a challenge. So if we could strengthen that area of referral systems, strengthening the entire system of health provision in the country would be very useful. And that needs more funding and government involvement, because without government, then we are doing nothing. The interventions will not be sustainable. So when we link the whole community strategy It's about actually government working with communities. And then the community takes control over their health issues. And therefore, if we strengthen that system, it will be sustainable because government, NGOs and donors and the communities will be working together. So I think we just need more resources, establishing more community units, and strengthening the whole system and the referral systems. This country will be good.